When I qualified, my license said Superintendent Pharmacist. Decades later, despite treating thousands of patients and mastering complex clinical cases, that title never changed. There was no clear ladder to climb, only the counter in front of me. Professor Trent Twomey, President, World Pharmacy Council. For decades, community pharmacy has remained the front line of primary healthcare in Nigeria, with more than 60% of patients seeking care first from their neighborhood pharmacist before visiting a hospital. Despite this critical role, community pharmacists operated without a structured career progression system, leaving many professionals with limited opportunities for advancement, regardless of their years of experience, clinical expertise, or commitment to patient care. The absence of a clear professional pathway contributed to stagnation, weakened morale, and discouraged many young pharmacists from embracing community practice. Rather than being recognized as an integral pillar of healthcare delivery, community pharmacy was too often perceived as a retail enterprise. That narrative changed under the leadership of Pharm Ambrose Igwekamma Ezeh, National Chairman of the Association of Community Pharmacists of Nigeria, ACPN, whose administration has pursued reforms focused on institutional growth rather than personal achievement. Inspired by Helen Keller's enduring words, "I cannot do everything, but I can do something. I must not fail to do the something that I can do." Pharm Ezeh's administration is consolidating on the Community Pharmacists Assessment and Career Progression Institute, CPACPI, the first structured career progression framework for community pharmacists. The initiative provides competency-based assessment, continuous professional development, and a clearly defined pathway for career advancement, while strengthening the role of community pharmacists within Nigeria's primary healthcare system. The initiative received strong backing from the Pharmaceutical Society of Nigeria, PSN, the Pharmacy Council of Nigeria, PCN, and other major stakeholders, working closely with the chair of the ACPN Board of Trustees and the Institute Board Chair, Dr. Iyeseun Asieba, an accomplished and highly respected pharmacy leader, and a distinguished technical team. Pharm Ezeh transformed CPACPI from a visionary concept into a landmark professional institution. The institute has restored professional pride, standardized clinical practice, and created a sustainable model for career progression that is attracting international attention. Nigeria has not merely adopted global best practices, it has developed an innovative framework that is now positioning the country as a reference point for community pharmacy advancement worldwide. A defining milestone came on March 5, 2026, when health leaders, regulators, policy makers, and international partners gathered at Newton Park Hotel and Resort, Abuja, for the official stakeholders engagement on the Pharmacy Forward, Performance, Collaboration, and Health Transformation Framework. The event, held in strategic partnership with the Pharmacy Council of Nigeria, marked the formal launch of a new era for community pharmacy practice. Today, CPACPI celebrates another significant milestone as it inducts and recognizes its second batch of participants, further expanding a new generation of community pharmacists committed to excellence, competence, and patient-centered care. The emergence of CPACPI demonstrates what purposeful leadership can achieve. Through vision, collaboration, and unwavering commitment to institutional development, Pharm Ambrose Igwekamma Ezeh and his team have placed Nigerian community pharmacy firmly on the global stage. As more countries study this pioneering model, Nigeria is increasingly being recognized not as a follower but as a leader shaping the future of community pharmacy worldwide.